Okay, we're going live. Good morning. Good morning, everyone. My name is Leslie Palomino. I am the Georgia State Director for Latinx. I want to thank our partners, legislators, and workers for being here today for our press conference. Today marks the 33rd anniversary of the Family and Medical Leave Act. When FMLA was passed, it was a historic step forward, but it only guaranteed unpaid leave. For millions of Georgia families, unpaid leave is not real leave. If time off means losing a paycheck, then caring for a newborn, recovering from an illness, or supporting an aging parent becomes impossible. That is why we are here to urge lawmakers to expand House Bill 1010 into a comprehensive paid family and medical leave policy for all Georgia workers. In Georgia, nearly 78% of workers have no access to paid leave. Paid leave means you can take time off to care for yourself or your family and still get paid. FMLA protects your job, but it's unpaid. So for many workers, time off is simply not an option. You'll hear today from advocates and legislators about why paid leave is an economic issue, a public issue, and a racial and gender justice issue. First, I want to introduce Daniel Campos, a Georgia community organizer with Latinx, who directly works with Latino and immigrant families impacted by the lack of paid leave.
Hola a todos. Thank you all for being here today. My name is Daniel Campos. I'm a community organizer with Latinx, a civic and social justice organization that advocates for economic, immigration, environmental, and energy cost affordability. Today, we mark the 33rd anniversary of the Family Medical Leave Act, FMLA, a law that was monumental step forward in the workers' protections. FMLA allows workers nationwide to take up 12 weeks of job-protected leave for serious health conditions, to take care of a new child, and to support a sick family member. Yet, it reaches far short of what it actually means. It guarantees no pay and strict eligibility rules leave millions behind. To qualify for FMLA, a worker must have worked 1,250 hours in the previous year and be employed by an employer with 50 employees or more. Millions of workers don't meet these criteria or can't afford to take unpaid leave. Nationally, 73% of workers have no access to paid family leave through their employers, meaning they may have to choose between their paycheck and their family's health. In Georgia, the picture is even starker. 66% of Georgia workers cannot access even unpaid FMLA benefits due to eligibility gaps. Each year, 430,000 leaves go untaken because workers cannot afford unpaid time off, resulting in $1.7 billion in lost wages, including $1 billion for women. In over 73% of Georgia households with children, all parents work. Yet many struggles without paid leave when caring for a newborn or a seriously ill one. These aren't just statistics. These are mothers, fathers, brothers, sisters, partners, and neighbors whose lives are shaped by policies that have not kept pace with modern families. I know this personally. In 2019, my wife and I were expecting our son, Isaac. He was born with trisomy 18 and lived only 20 precious days. During that time, I balanced full-time and part-time work while attending Georgia State University. My wife was a full-time worker and a student. Neither of us had paid leave. We were not eligible for FMLA because our employer had fewer than 50 employees. We lost our jobs, drained our savings, and faced repeated health and emotional challenges. If we had access to paid leave, even a portion of our income, we could have focused on healing, not financial survival. Our experience is not unique. It shows why change is urgent. The United States remains one of the only industrialized nations without a comprehensive national paid leave, deepening economic and health disparity. But there is hope here in Georgia. In 2024, the state passed HB 1010, providing 6 weeks of paid parental leave to all eligible state and public school employees, a step in the right direction. Today, on this FMLA anniversary, we celebrate progress, but call on legislators to go further. To our champions in Georgia legislature, we thank you for supporting HB 1010, but we must expand it to 12 weeks for all public sector workers and educators. And we ask you to introduce and pass a comprehensive paid leave bill for all workers in Georgia, regardless of employer size, industry, or income. Paid leave is not a luxury. It strengthens families, stabilizes our workforce, and ensures no Georgian has to choose between their job and their family well-being. Today, let us recommit not just on celebrating progress, but to building a future where every worker has security, dignity, and support they need. Thank you.
Thank you, Daniel. Next, we'll hear from Michelle Suave, lead campaign organizer with 9 to 5 Georgia, a longtime champion for working women and working families.
Good morning, everyone. My name is Michelle Sauvé, and I serve as a community organizer with 9 to 5 Georgia, and also proudly serve as the lead for the Georgia Coalition for Paid Leave. The Georgia Coalition for Paid Leave is a statewide alliance anchored by 9 to 5 Georgia. We unite workers, caregivers, health advocates, community organizations, small business owners, and impacted Georgians, and believe that every Georgian should be able to care for themselves or their loved ones without risking income or employment. No one should have to choose between their health, their family, and a paid check. So what is paid leave? What are we talking about here? Paid leave is a policy that allows workers to take time off while continuing to receive their wages. It supports longer-term needs, usually more than sick days. So different types of paid leave include parental leave, right? So recovery after childbirth, or bonding with a new child, or adoption. Family leave, which is caring for a seriously ill family member. Medical leave, recovering from your own illness. And military leave, and so much more. Why paid leave is needed, it's been reiterated by folks here, but in the state of Georgia, 76% of workers do not have access to paid leave. 66% of Georgia workers don't have access to FMLA, which has already been emphasized as unpaid. Even those who qualify often cannot afford unpaid time off, which really goes to show the need for paid leave in Georgia is clear and it's urgent. Currently, only 13 states plus DC have a paid leave program in the US. This is due to the fact that the United States is one of the only industrialized nations in the world that does not have a federal paid leave program. And we decided as a coalition to take that struggle here to the state of Georgia. We started in 2021 and we were able to advocate for the passage of the first paid leave law in the state, which was 3 weeks of paid parental leave for state employees and public sector workers. In 2024, we were able to expand that 3 weeks to 6 weeks of paid parental leave. And while we welcome this progress and it is a step in the right direction, it is not enough, and so many Georgians are still left out. Our coalition has been doing the continuous work of educating communities across Georgia about paid leave, elevating worker and business voices, building momentum for paid leave policies, and supporting working families statewide. What we need is an expansion of House Bill 1010. We need a comprehensive policy. That means expanding the 6 weeks to 12 weeks. That means workers being able to use leave more than just for birth or adoption, but again, to care for their family members, to take time off when they're in bereavement, when they're time off for bereavement, and just in general when life happens. So our call to action is that we want everyone to check out, join the Georgia Coalition for Paid Leave. We need the people's voices here at the people's house to show lawmakers that paid leave is not just a nice thing to have, but it's a necessity for working people in Georgia. When workers, families, and businesses stand together, we can demonstrate real political will. And Georgia can be a state, right? We hear it all the time. Georgia's the #1 state for businesses. But what does that mean to also be the #1 state for workers, right? We think that paid leave is a core part that can help build an economy that truly works for the state of Georgia. Thank you.
Thank you so much, Michelle. I'm honored to welcome Alicia Southworth, Georgia Campaigns Director with Reproductive Freedom for All, to speak about the connection between paid leave and maternal health.
Good morning, everyone. My name is Alicia Stallworth. I'm the Georgia Campaigns Director for Reproductive Freedom for All. Thank you all for being here today. Today marks the anniversary of the Family Medical Leave Act, a reminder of how hard people have fought for the right to care for their families without losing their jobs. But 3 decades later, for too many families, unpaid family leave is still not an option. The reality is clear. Unpaid leave still forces families to choose between caring for the people they love and keeping a roof over their heads. I'm here to talk about why paid family and medical leave matters for working families. As everyone has stated the statistics before me, roughly 4.1 million people lack access for paid family leave through their jobs. That means when a new baby arrives, when a parent gets sick, or when someone faces a serious health crisis, too many Georgians are forced to choose between their paychecks and their family. And it's important to say this clearly. Georgia's current policy does not account for all family experiences. Sorry. Under current law, paid leave for state employees does not cover stillbirth or the loss of a child. Families experiencing profound loss are left without the time and space they need to grieve and heal. And that is unacceptable. Georgia is on the front line of attacks on reproductive freedom. We've seen firsthand the deadly and devastating consequences of politicians stripping away people's ability to make choices about their families, their bodies, and their own futures. And when we fight for reproductive freedom, it does not end at access to care. It includes paid family and medical leave, the freedom to care for yourself and your family without fear or financial ruin. Because everybody deserves the opportunity to support themselves and their families, and in the coming years, costs are only going to keep rising, and caregiving demands are only going to increase. Georgia loves to call itself #1 for business, but being #1 should mean supporting the workforce that keeps the state running. Paid family and medical leave keeps trained workers on the job, reduces turnover, and strengthens Georgia's economy. Other states have shown that this can be done. Georgia should not be left behind. Paid family leave, affordable health care, and access to reproductive health care are all intertwined, and they're all economic issues. Working families deserve the freedom to care for the people they love in the moments of joy and in the moments of loss, and still have the resources to build a future. That is why we're asking Georgia to extend the HB 1010 legislation to have a more comprehensive paid leave plan that not only includes state workers, but all public workers as well. Thank you so much for your time.
Now we are so grateful to be joined by legislative leaders fighting inside the Capitol for Georgia families. Please welcome Senator Sheikh Rahman, who recently voted in favor of extending paid sick leave from 3 to 5 days for teachers.
Thank you. Hi, my name is Senator Sheikh Rahman. I represent part of Lawrenceville, Northborough, Stuttgart, Duluth, and part of Lilburn. Glad to be joining with you all. In terms of paid leaves, we are behind the nation, state of Georgia, but we're heading in the right direction. What I'd like to say is it's so important that sometimes we have to choose between our families and our livelihood. What do? We go to work, we take our sick children, to the hospital or take care of our parents. So this is the issues that affect not only our own family, sometimes to our community, to the state. We passed a bill SB 148 just this session, last session, House passed, we agreed with it. That bill increased the paid leave right now for all the educated in the state of Georgia from 3 days to 5 days. So that 2 days expansion, that's in the right direction. That's what we are trying to do in the state of Georgia in terms of, in terms of legislation, what we can do. And I'm glad that this bill, that SB 148 that we passed, is a bipartisan bill, and we have people work in the House and the Senate to get it achieved. And we need to continue to do the same thing, because that's the only way we can keep up with what's going on all around the world. It's not necessarily Georgia, not only the United States. We are really behind in terms of paid leaves. Working families, if you're rich, you have your own business, whatever it is, you're millionaires, you'll be all taken care of. But what about the regular folks? The people goes to every day to work to make sure they can pay their bills, take care of their families, and sometimes you get sick, your family gets sick, and you have nowhere to go. You got to go to work. So this is something that we all need to work on it. And I appreciate all this organization, Georgia, you're coming together and speaking up. We need you to come together and continue to speak out. That's the only way you can make a change. You are the people outside that Gold Dome, outside the Capitol, know exactly what's going on. If you come and see us and call all your legislators in your districts or outside your district, because that's the only way we can raise the issue. Once you raise the issue, we can move forward. And that's my ask to you all. And thank you for being here and listening to us. And keep continuing to help us move this state forward. Thank you.
Thank you so much, Senator. Next, we will hear from Representative Martin.
Thank you so much to for all 95 and so many different partner organizations. It's been said, but I'll frame it a different way. One of the toughest decisions people make, yet also one of the most common ones, are parents who have to choose between providing financially for their children when they're sick and when other life circumstances come up. They're actually having to be there to care for their children and families. I personally wouldn't want anyone to be in that position as well. And I imagine anyone listening wouldn't want to be in that position. Thousands of people are in that position. Be clear, work hard. They want to go to work. They need to go to work. Yet, of course, want or after newly adopting, having a child, or to the military, or so many other circumstances that have been mentioned. Again, it cannot be said enough. These are people who want to work and want to do right by their family. And we know from both the other as well as common intuition that these are crucial moments that will set up a child's success for life or leave them to dig themselves out of a big hole if they cannot bond, attach with their parent, or get the care that they need otherwise. With HB 1010 and before that HB 146, Georgia did take huge step forward, state government employees, school board employees, and now with SB 148 for teachers in Georgia. But still, we know so many people in Georgia don't have this. As has also been said, Georgia has cast itself as a pro-business state, but it also cast itself as a family, has done around maternal and important work, and it has cast itself as pro-work, meaning it wants people to go to work. Yet we cannot be truly pro-business, pro-work, or pro-family without paid parental leave, without providing the means for people who, I will say it for the last time, both want to go to work and want to provide for their families, as we all encourage, but without providing the means for them to do that. I will end with a call to action. This is not necessarily one of the most controversial policies publicly, yet in speaking to employers, whether public or private, they are worried about the cost of society. If you are in any position of power at work, please speak to your employer. Tell them about the importance of paid parental leave. It is something, the costs that we see are not necessarily visible to us, but they are there every day. And conversely, the rewards will be great, including to businesses, if we get this done. So please speak to your employers. And again, as my colleague Senator Amana said, speak to your lawmakers. Thank you.
Thank you so much, State Representative. We also want to recognize our partners standing with us today, 9 to 5 Georgia, Georgia Values Action, the Union of Southern Service Workers, BOM Rising Together, and the Georgia Coalition for Paid Leave. As a reminder, today we are here for the 33rd anniversary of FMLA, and so we want to thank all of our speakers and partners. And as a reminder, paid leave is not a luxury, it is a necessity. It keeps families financially secure, improves health outcomes, and strengthens Georgia's workforce and economy. We called on the Georgia General Assembly to build on House Bill 1010, expand it to 12 weeks, and ensure that every worker in Georgia can care for themselves and their families without falling into poverty. Join 9 to 5 Georgia on February 17th for an advocacy day and learn more about paid leave. Speakers will be available for interviews immediately following this program. To our legislators, Georgia families are counting on you. Thank you.